Welcome to Tuesday's edition of COVID-19. There has been an alarming rebound in daily cases today, and given the recent ease in social restrictions, authorities are calling for a greater sense of responsibility from members of the public with regard to prevention efforts. I have Kwon-Seo standing by now with the broader pandemic update. Right, Soa, Korea has recorded well over 400 infections today.
Right, Sunny. That's a surge by over 100 more cases compared to Monday. As this Tuesday, the government has posted 457 infections, and that includes 429 domestic transmissions. So that number is also over 100 more cases compared to yesterday. And with that, Korea has a total number of 84,325 infections, and the death toll stands at 1,534 with 7 additional fatalities. Now, following 3 straight days in the 300s, we are now back to the 400s, with the government especially calling for vigilance as social distancing measures have just been eased since Monday. And also, authorities have yet to assess whether there was an increase in transmissions during the recent Lunar New Year holiday. Now, that needs more observation in the coming weeks. But among the new cluster infections, a boiler manufacturing plant in Chungcheongnam-do Province's city of Asan reported 55 cases, with some 650 people being tested, and some results still need to come out. Now, that cluster is also the reason for the figure we're seeing here in Chungcheongnam-do Province, 58 infections, but not all of the factory-related cases have been added to this figure as of 12 a.m. Now, this figure was in the single digits just yesterday. Meanwhile, over 300 cases were reported in the metropolitan region, but also more than 100 cases combined outside of the metropolitan region.
Right. Meanwhile, so I hear we have some positive news on the vaccine front.
Right, Sunny. The government has secured vaccines for some 23 million additional people. That brings the total now to 79 million. And it includes a deal with Novavax for 20 million people and also additional Pfizer vaccine shipments. Here's the Prime Minister on the details.
We've reached an agreement to fast-track the delivery of 1 million Pfizer vaccine doses for 500,000 people from their original shipment date in the second half of the year to the end of March. We have also signed a deal to purchase 6 million additional doses for 3 million people to be distributed in the second quarter.
Meanwhile, the World Health Organization has approved 2 versions of the AstraZeneca vaccine for emergency use, those produced by South Korea's AstraZeneca SK Bio and India's Serum Institute. Now, while vaccination is progressing around the world, with some places faster, in some other countries slower progress, it does seem to attribute to the decline in numbers of infections in some countries, like the U.S., currently at 28.3 million, but 56,000 new infections, which is much lower than over 100,000 the country saw in weeks before. And also here, the UK and India, both of these saw less than 10,000 new cases, some 9,700 in the UK. That's the lowest figure in quite a long time. And the total number of infections around the world stands at 109.6 million, and we also have some 2.4 million accumulated deaths. And those are the numbers I have for now, and I'll be back with more after the government briefing. Sunny?
Right, so I'll see you in a bit. With 10 days left to the launch of COVID-19 vaccinations here in Korea, authorities are busy fine-tuning details to ensure a productive campaign. I have Kim Ji-yeon here in the studio with details on that. Welcome, Ji-yeon.
Hello again.
Right, so let's begin with Korea's public inoculation, which will start next Friday.
Sure. Korean health authorities said the country will start administering AstraZeneca vaccines starting February 26. This is the first step in Korea's quest to reach herd immunity, which requires 70% of its population of some 52 million to be inoculated by November. An estimated 272,000 people under the age of 65 who either live or work in nursing homes and other high-risk facilities will receive the first vaccines. Authorities said the decision to administer the vaccines to those aged 65 or older will be put on hold due to ongoing concerns over their efficacy and insufficient clinical trial data on the elderly. A special panel comprised of local experts may reach a decision by the end of March on whether to clear the use of AstraZeneca shots on the elderly after reviewing more clinical trial results from the U.S. and the outcome of vaccinations in the U.K.
The AstraZeneca vaccine has already been approved for those aged 18 or older, while its safety and antibody response have been verified in those aged 65 or older. But there were only 660 subjects in the clinical trials, and a very small number of people tested positive in both our control and treatment groups, which were far too few to derive any statistical significance.
Germany has restricted the use of the vaccine for those over the age of 65, while Switzerland and South Africa have postponed the approval of the AstraZeneca vaccine. Meanwhile, 48 countries, including the UK, have granted emergency use authorization for the vaccine, while WHO scientists have backed the AstraZeneca vaccine for use in all age groups.
Right, Jian. Meanwhile, back here in Korea, which groups will be inoculated next month?
Well, inoculations for an estimated 354,000 medical staff working at general hospitals with a high number of seriously ill COVID-19 patients will kick off on March 8th. Some 78,000 people, including COVID-19 first responders like paramedics, disease control personnel, and contact tracers, will get their shots in mid-March. But since vaccinations for the elderly are on hold, there are concerns that Korea could fall short of its target of reaching herd immunity by November.
Right, and staying with that topic, tell us a bit more about the hurdles in securing that goal of herd immunity.
Sure. While the country believes that it can still administer the vaccines to high priority groups within the first half of the year, some experts believe the clinical trial data needed to proceed may not be available until April if there are delays. So depending on how this plays out, inoculations for the elderly may be delayed even further to the latter half of this year. Also, there's the worry that pharmaceutical companies may not deliver the vaccines as scheduled due to a supply shortage. Despite the government reassuring the public that it has inked additional deals for Pfizer and Novavax vaccines, their arrival dates are still uncertain. Already, Korea's plan to vaccinate 55,000 healthcare workers treating COVID-19 patients has been, delayed with uncertainties. The plan is to inoculate these workers with Pfizer vaccines secured from the COVAX facility, but no arrival date has been set.
Right, Jen. What then are some alternatives that Korea could perhaps explore?
Well, some experts say that Korea should consider distributing the vaccines to those in the lower priority groups while it waits for the clearance on their use on the elderly. Also, having more vaccines from different manufacturers could be helpful as new strains of the coronavirus continue to spread worldwide with unknown implications on vaccine efficacy. Recent clinical trials by Oxford University show that even with the 2 doses of the AstraZeneca vaccine, the protection it offers against the South Africa strain is limited compared to other vaccines.
I see. All right, Cheon, as always, thank you for that coverage.
Thank you.
Right, staying on the local front, it's time now for the regular briefing on the COVID-19 situation here in Korea for this Tuesday. As mentioned earlier, social restrictions have been slightly eased starting this week until the 28th of this month. The Greater Seoul area now faces level 2 social distancing guidelines, while the rest of the country is under level 1.5. The ban on gatherings remains in place with 5 or more people not permitted to meet for social purposes. An exception has been granted to immediate family members only, including grandparents, parents and children. Also, a few businesses, including movie theatres, internet cafes, video game arcades, cram schools, amusement parks, as well as retail stores, face no limit on operation hours. Meanwhile, restaurants, cafes, indoor gyms, singing rooms, party venues and indoor standing concert places can be open until 10 p.m. here in the metropolitan region. The briefing is about to start. We'll come back to you afterwards.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea for February 16th. As of today midnight, we have a total of 429 new local infections and 28 new imported cases. The total caseload now stands at 84,325. Currently, we have 8,240 people remaining in quarantine, while there are 166 patients with critical or severe conditions, up by 10 from the day before, and we had 7 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now go over major updates of our domestic infections. Nationwide, we see a total of 429 new local infections, 303 in the capital area and 126 in the non-capital area. 66 in the Chungcheong area and 13 in Gyeongbuk area and 30 in Gyeongnam area and 4 in Gangwon-do province. And we also have 1 case being reported in the Jeju Island. And by region, here are some cluster domestic infections in the metropolitan area in relation to the University Hospital in Seoul's Yongsan-gu City. We also have identified 30 additional patients and increasing the total to 117. And in Seoul's Gangbuk-gu district, in relation to a public sauna, after the 10th of February, we have been identified 8 additional patients, and a total of 42 have been confirmed to date. And in Seoul's Yongsan-gu district, in relation to a friends gathering, we have 4 additional patients, and a total of 68 have been confirmed to date. And in Incheon Seogu district, in relation to an office space, we have 15 additional patients being confirmed, and a total of 16 have been confirmed to date. And in Gyeonggi-do province, Gwangju city, in relation to the second manufacturing company, we have 10 additional patients with a total of 11 being confirmed to date. And in Gyeonggi-do province, Namyangju city, in relation to the Night Protection Center and the Pocheon city manufacturer, we have 3 additional patients being confirmed with a total of 23 being confirmed to date. And in Gyeonggi-do province, Goyang city, in the dancing room, we have 2 additional patients and a total of 77 have been confirmed to date. And in Gyeonggi-do province, Yeoju city, in relation to the second relatives gathering, we have 2 additional patients being confirmed, and a total of 24 have been confirmed to date. And in Gyeonggi-do province, Bucheon city, in relation to the Yongsengyo religion and the after-school hagwon, we have 11 additional cases, raising the total to a total of 151. And in Chungcheong province, in Chungcheongnam-do province, Asan city, in relation to a boiler manufacturing company, we identified the first case on the 13th of February, and a total of 53 additional patients have been confirmed, and a total of 54 have been confirmed to date. And in Chungnam province, Dangjin city, in relation to a retail company, we have identified 6 additional patients. A total of 52 have been confirmed to date. And in Gyeongbuk province, in Daegu Donggu district, in relation to a restaurant, we identified the first index case on the 14th of this month. We identified 9 additional patients, and a total of 10 have been confirmed to date. And in Gyeongnam area, in Busan Bukgu district, in relation to a funeral house, we identified the first index case on the 11th of this month. A total of 10 additional people have been confirmed, and in total, 11 have been confirmed to date. And also here in South Korea, we are seeing some risk factors stemming from the new variants. As of today, February 16th, we see a total of 94 cases of the new variants have been identified here in South Korea. Moreover, there are many other countries reporting more new variants as well. And as of the 15th, as of today, we have a total of 90 countries worldwide seeing such new variants. And also in the first month of this month, we have seen 54 cases. And by today, which is only in about 2 weeks, we see about 94 cases. That is why we are also exerting a full vigilance and increasing our monitoring on these new variants. And also we are requiring all of the foreign entrants to submit their PCR negative document. And also, we are making sure that we have strict quarantine measures for those on self-quarantine after coming into Korea. And moreover, if you are on self-quarantine here in South Korea after coming in from abroad, as well as their immediate family members, we ask you to comply strictly with the quarantine measures. Lately, we have seen at the Islamic mosque, we have seen a major cluster infection here in South Korea, and this was also in relation to the Gyeonggi-do province and the manufacturing plant. We identified the first index case on the 6th of February, and we identified additional patients were confirmed at the Islamic mosque. And one of the risk factor was that they did not have a responsible personnel in charge of quarantine measures, and they did not have the electronic visitor log, and they also did not have a good ventilation system, and they had small group meetings as well, and they also had group meals together, and they cooked meals together, and they did not keep the social distancing measures. And by transmission sources, we identified one person which also has spread the virus to other members of the mosque. And this particular cluster infection, we can see that this is very much related to our daily routine, especially for those for foreigners who are living here in South Korea. Moreover, we have been seeing that these people have also participated actively in testing and also closing down voluntarily the mosque. Moreover, we have seen many cluster infections stemming from indoor sports gyms as well as dancing rooms, and we are also assessing the particular risk factors. And we see a total of 8 cluster infections, a similar cluster infection, and a total of 251 people have been confirmed. And we see there were indoor sports facilities and indoor screening golf as well, and dancing rooms and so forth. As for the dancing room, we see 72 people have been confirmed. In Taekwondo area, we have 58 people being confirmed as well. And we see that if one cluster infection breaks out at similar facilities, we see a wide spread of the infections. And as for the table tennis and the other sports facilities, indoor sports facilities, we see that they had a lack of mask wearing, and also there were many respiratory droplets as well. And as for indoor swimming pool and the indoor sports gyms, we see that there were environments that people could not wear face masks, including the showers and locker rooms. And as for the dancing room, they did not have personnel in charge of quarantine measures, and also they also did not comply well with the face mask protocol. Moreover, we are seeing many multi-use facilities and religious facilities, as well as many other day-to-day venues reporting cluster infections. And especially after the Lunar New Year holiday, we are returning back to our routines. And we believe that during these holidays, we could have seen a spike in contacts. So we ask for all of the foreigners living here in South Korea to also keep in mind and take particular precautions, and especially when you are visiting large crowds of people, please test yourself if you have any symptoms after visiting these centers. Moreover, the hospitals, especially, it is very important to stem the infections, and this is why we are carrying out regular massive testing at these hospitals. And we need to also have a regular monitoring of people who have symptoms, and also we need to test people on a regular basis. And moreover, if a user has any symptoms, he or she shall not visit such healthcare facilities. And moreover, they should not consume food or beverage at these facilities. So please also comply with face mask wearing protocol as well. And all of the managers of these facilities need to ventilate their space on a regular basis, and also disinfect area on a regular basis as well, in order to protect the users and the staff members. Moreover, this is not in relation to the COVID-19 virus. However, we would like to mention the Ebola spread in Africa. We have identified that in the African country, we have seen the spread of the Ebola virus, and this is why we have been also intensifying our quarantine measures for those people coming in from Congo as well as Guinea. So we ask for you to also take particular precautions when you are visiting these countries, and please refrain from taking into and coming into contact with wildlife, and also comply strictly with the quarantine measures. And when you come back to Korea, please also comply well to our quarantine measures as well. And especially after the Lunar New Year holiday, this week we have seen an ease in the social distancing measures, and we could also see a higher risk of infection spread. So we ask you to also comply with the basic quarantine measures, including washing of your hands, as well as a face mask wearing. And test yourself if you have any symptoms. And the quarantine authorities will also make sure that we decrease the daily tally here in South Korea, and we have the rollout of the vaccine, and also begin a safe new school year for our students. So we ask for your participation in the following 3 aspects as well. And these are, first of all, please refrain and please minimize any private gatherings, and please stay home as much as you can, and also switch all of your religious gathering meetings non-face-to-face means. And second, when you are visiting multi-use facilities and when you are at indoors, please also keep a self-distance. And also, if you have any symptoms like fever or respiratory symptoms, please test yourself as soon as possible. And we are nearing the season of spring, and we believe that we need to return to a state of normalcy, and to this end, the quarantine officials will exert our full efforts. And to this end, we also ask for your continued efforts. Please continue to exert a sense of vigilance going forward. Thank you very much.
Right, that was Lee Sang-won with Tuesday's afternoon briefing. What did he have to say, Soa?
Well, you mentioned some places of concern where cluster infections have been rising again. For instance, at indoor sports facilities, some 251 cases recently were confirmed at a number of indoor sports facilities, which include dancing rooms, taekwondo, and table tennis facilities. And people there were said to have not abided by basic social distancing guidelines, such as wearing face masks. And also, at a manufacturing factory, there were cases linked to an Islamic mosque. So there also some basic guidelines were not abided by. So at these places, extra vigilance is needed. He also had some updates on the variants from abroad. As of today, 94 cases have been confirmed. And he stressed that the number is rising at a faster speed than before, because in the first week of February, there were 54 cases confirmed. And now we're 2 weeks past this month, and now we're already having 94 cases. And he also had a quick mentioning of the Ebola outbreak in some African countries. So there's also being measures at the airport. He's also calling for cooperation on people who arrive from such countries.
Right. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Korea's COVID-19 strategy is regaining global attention as people seek better protection against the pandemic despite the rollout of vaccines. In fact, there's fresh spotlight on Korean-made face masks. Do take a look.
More than 1 year into the pandemic, Korea is continuing to find creative ways to fight COVID-19. In December, a locally developed RT-PCR testing method was adopted as an international standard by the ISO. Korea's drive-through screening centers, walk-in testing booths, and residential treatment centers have also been adopted in many countries abroad and are now awaiting ISO certification. Korea has also emerged as a world-leading provider of medical supplies, and Korean-made face masks in particular have become highly popular in the US, where a federal mask mandate is now in force.
And the first order I'm going to be signing here relates to mandating masks be worn.
Korean-made KF94 face masks have gotten rave reviews from US media outlets and health experts alike. KF is short for Korean filter, certified by the Ministry of Food and Drug Safety, and the 94 refers to its filtration rate of 94%. Like the N95 masks approved in the US, the KN95 from China and the FFP2 from Europe. The KF94 masks are highly effective at filtering viral particles, blocking over 90% of the wearer's respiratory droplets. Korean mask manufacturers have seized the opportunity and have set their sights firmly on the export market.
We've increased mask production by 5x from 400,000 pieces per day to 2 million pieces. We have contracted an export with the distributor as OEM, and we are discussing export contracts with other distributors.
This mechanical engineer in the US tested the KF94 masks and posted an in-depth review on its benefits, and is being credited for getting the word out on KF94 masks in the US. The US has now become more discerning in its choice of face masks, after being plagued with quality defects and counterfeit issues. US experts widely agree that Korean-made KF94 face masks are reliable, meeting rigorous standards set by the Korean government.
There has been a bit of a shortage of N95 masks. And I must confess, there is some uncertainty about the KN95 masks, which are much more widely available because there have been several instances where there were knockoffs and the performance characteristics of the KN95 masks were not as advertised. I think that the US public has confidence in products that are produced from South Korea, and therefore there would be more trusting of KF94s, feeling that they would perform as advertised.
Over in Europe, Austria's government has also included KF94 in its guidance as part of a list of recommended face masks. Several states in neighboring Germany have also approved the use of KF94 for medical use.
한국 PP, 그러니까 퍼스널 프로텍션 제품들이 독일에서 좋다는 그 인식을 가지고 있기 때문에 많은 한인 업체들이 KF94 마스크에 FFP2 로고와 C 인증 마크를 찍은 것을 유럽에서 인증을 받아서 판매하기 시작했습니다.
Korea is making a difference in the world in its fight against the COVID-19 pandemic, one mask at a time.
요양병원 요양시설 입원 입소자 및 종사자에 대해서는 만 65세 미만 27만 2천여 명을 대상으로 2월 26일부터 아스트라제네카 백신 1차 예방접종을 시작할 계획입니다.
Korea's inoculation campaign will kick off next Friday with AstraZeneca's vaccine. The approved doses have been produced by SK Bioscience and will not be administered on those aged 65 and above, as announced by authorities during their briefing on Monday afternoon. For more on the vaccination drive here and elsewhere around the world, I have Professor Chung Gi-seok from Hallym University. Pleasure to have you back, Professor Chung.
Thank you for having me.
And joining our talk virtually is Dr. Katharina Song from the International Vaccine Institute. Welcome, Professor Dr. Song, that is.
Good afternoon.
First then, Professor Chung, does Monday's decision to exclude the elderly from the use of AstraZeneca's vaccine look to affect our plans to promptly protect our high-risk groups?
Yes. The latest figure is 370,000 people who are over 65 and admitted to nursing facilities like a nursing home, nursing hospital, and a mental sanatorium. And they are postponed to a second quarter, about 3 months later. So at that time, we'll have a Janssen vaccine or a Novavax vaccine, and etc. But 3 months' time is not a very short time. What if we have another big wave during that time? As we know, 4% of all COVID-19 patients are going to severe and very severe cases, and 45% of them are dying of COVID-19. So if you calculate roughly, if you have 100 and 200 patients every day in the ordinary time, you can see 2 or 3 or 4 people dying every day. And when you have a big break, then you have more casualties over there. So by that time, after several months later, we could see several hundreds of deaths who could have been prevented from vaccinated earlier.
Right, a rather grim outlook. Dr. Song, authorities here are awaiting results of additional clinical trials from AstraZeneca's study in the US that involves 30,000 people, including 7,500 senior citizens. What do these results need to show to allow for a shift in Monday's decision to exclude the elderly from the use of AstraZeneca's vaccine?
It is not easy to say at this point. But the results should show meaningful efficacy to prevent the disease in elderly population, and safety profile should not be compromised.
Professor Chung, meanwhile, authorities here hope to secure herd immunity by November. Is this possible?
Yeah, before I say about herd immunity, if I add up on the AstraZeneca vaccine, I found out that that interval is should not be exactly 4 weeks or 8 weeks. If you dissect the result of AstraZeneca vaccine, the whole efficacy is 62%. That is from 4 to 12 weeks period, the second shot. But if you dissect the result into a 4 to 8 and 9 to 12 weeks interval, the later part is better. So the first, the 4 and 8 weeks interval shows only around 50%. And 9 to 12 weeks later, if you get a second shot, it is 68% efficacy. So if you inject elderly people in nursing facilities in February and March and wait for the result, we are waiting for a clinical phase 3 trial from USA, then we have a good result, then we can inject another second dose vaccine in 3 months' time. That is more efficacy and more effective, and we have time. So if you decide after 2 months or in March or April to get an AstraZeneca vaccine reused, then you have to wait another 3 months before you have a full efficacy effect. So that's I like to add on AstraZeneca vaccine. Regarding the herd immunity, KDCA wants to make before November. And today, KDCA have contract with Novavax, which have provided another 20 million. So again, the Pfizer has promised to provide additive 3 million. So it all sums up 76 million population doses. So it's enough. But the thing is that how fast we can get the stock in our hands. If we don't have a sufficient amount in the right time, then we cannot get herd immunity by November. So we have only 6 months left. First quarter is over. We are waiting for only 1 billion about doses. But the second quarter and until September, we have to provide 34 billion doses for 34 billion people. So is it possible or not? We have to see.
Right. That is a rather daunting challenge, though. Dr. Song, there is talk about a significant delay in shipments worldwide from the global vaccine sharing initiative, COVAX. What are your thoughts on this?
COVAX facility recently published its plan to distribute more than 330 million doses to developing nations in the first half of 2021. The first round of distribution includes 336 million doses of vaccines, 240 million made by the Serum Institute of India, and 96 million by AstraZeneca, as well as 1.2 million doses of Pfizer vaccine. Korea expects Pfizer vaccine for 55,000 and AstraZeneca vaccine for 190,000 people supply through COVAX facility in late February or early March. And these vaccines will be vaccinated to those who are working in hospital treating COVID-19 patients.
Right. Professor Chung, the world's first inoculation took place in the UK, I believe on the 18th of December. That was our first COVID-19 vaccination. Now, some pundits claim that the pace of vaccination is not as fast as it should be. What are your thoughts on this?
Yeah, it is true. It's not fast as we expected. I heard that the UK has just over 10% of their population inoculated. USA is hurrying very much, but they are not getting to the target so far. And the other countries that, like Israel, they're doing very good. And UK and Israel has seen already significant decrease of confirmed new cases. That's good. But USA and EU are complaining of a shortage of vaccine, and they are pushing their own companies to get the vaccine as much as possible and as early as possible to protect their people. So we don't have any vaccine in our hands. We do not produce them. So we don't have any promise to get the vaccine in a proper time. And when you think about the middle income and lower income countries, some of the countries has not any contract with vaccine companies and even not started their vaccination. So that's why the COVAX facility exists for. And I want United Nations and WHO and other international cooperative agents to work together and to get the middle income or lower income countries' people to get the same vaccine. Because there is a saying that the vaccine passport or vaccine certificate are required, could be required in some countries. That is another discrimination from poor and rich. So we need to cooperate. And having said that, I like the Korean government to not pushing too much on the COVAX facility, because we have provided a contract to 76 million. The COVAX is 10 million. So maybe we can leave it to a COVAX facility and not pushing them too much.
Right. Meanwhile, Dr. Sung, staying with what our Professor Chung has just said, there are some who believe that it might take even 7 years for the global population of 75% of the global population, that is, to be vaccinated. Having said that, what are your thoughts on efforts to ensure a more productive vaccination campaign across the globe?
So in different countries, there are different kinds of difficulties that they are going through. In US, it seems that electronic vaccine administration management system implemented by US Centers for Disease Control did not operate smoothly as planned, creating login or registration problems. On the other hand, in Europe, COVID-19 vaccine supply was not sufficient than anticipated. It has been reported that the supply amount of AstraZeneca vaccine in the first quarter of the year was planned as 80 million, but 60% was reduced, that only 31 million doses will be supplied.
Right. Professor Chung, as Dr. Sung has pointed out, there are production problems of vaccines across the world, which is why a number of developing countries are turning their attention to Chinese and Russian vaccines. What are your thoughts on this trend?
Yeah, many doctors and specialists was worrying about the efficacy of Chinese vaccine and Russian vaccine. But it doesn't matter whether it is made in any country. What the specialists are wanting is well-designed clinical trial, and which is published in so-called alpha journal, peer-reviewed journal. Then we can see and we can trust the whole result. If you look at the Russian Sputnik vaccine published in the Lancet, it is amazing because it has used the same vector like adenovirus, like Janssen and AstraZeneca, but efficacy is over 90%. It is interim analysis, but if you look at the paper in scrutiny, 21 days after second vaccination and 7 days after second vaccination, all shows over 90%. It is a tremendous figure. AstraZeneca is 62%, maximum 70%. Janssen is a bit around 80%. It's 90% effectiveness. This is a huge, amazing story. The reason why we don't know, but the Russian vaccine uses two different adenovirus. First vaccine used adenovirus type 26, and the second one adenovirus type 5. So two different adenovirus vaccine might have made immunity stronger than the other comparatives. Regarding a Chinese vaccine, I had the chance to chair the doctors between China and Korea in web seminar 2 weeks ago. The doctors from China are working at the Beijing University First Hospital. And doctors from Korea belong to Korean Respiratory Disease Society. And in that conference, we shared the treatment experience, but we also talk about the vaccine. And one Chinese doctor told us that the Chinese vaccine is working very well. We do not believe their words, but if it is published in a very nice journal, then we have to believe that. So I asked him about when is it going to be published. Then maybe sooner or later they are going to publish them. But they are only waiting for a sufficient patients to be recruited. So we'll see. Maybe in several months' time, the Chinese vaccine will be appear as a very nice vaccine, adding another very nice vaccine.
We'll have to wait and see then.
Yeah.
Meanwhile, Dr. Song, how worried should we be about concerns that the UK variant may soon become the dominant form of the coronavirus worldwide?
Mutation in certain regions can allow the virus to evade antibodies. There are laboratory studies to examine the ability of antibodies when presented with the mutation. In the studies, it was highlighted that the importance of examining the combined effect of multiple mutations as opposed to studying only individual ones, as it is unlikely that any single mutation will lead to complete escape from natural or vaccine-derived immunity.
Professor Chung, how do you assess preparations here ahead of the launch of next week's inoculation drive?
Yeah, because on adding to Minister of Health and the KDA, the Minister of Defense and Minister of Land and Transportation all are participating. They are acting like a military mission. And we have 250 hospitals and centers participating, 10,000 clinics participating also. So I don't think we don't have to worry much about that.
Right, preparations are going quite well then. Dr. Song, what are some of the variables that Korea needs to keep an eye on as it prepares for next week's vaccination?
Korea has introduced a well-systemized national immunization program and electronic nationwide immunization registration system already adopted in place. Nevertheless, we are expecting actual vaccination soon in Korea. We need to be prepared in advance as COVID-19 vaccines are different in some ways with other conventional vaccines. Those were included in national immunization program. We are using mRNA vaccine for the first time, and this vaccine requires specific cold chain management. And not like other vaccines in pre-filled syringes, which were often used in Korea, a bottle of COVID-19 vaccine has to be divided into appropriate amount of injection per person. And this requires simulations or trainings for the vaccination staff. And as we proceed with massive immunization, systematized adverse event monitoring and appropriate handling and communication on adverse event-related issues will be important on national immunization rates.
Right, Dr. Song, thank you very much for your thoughts. And Professor Chung, thank you very much for your insight.
Thank you.
Right, the words of wisdom ahead of the vaccination campaign are put prevention at the heart of Korea's inoculation. Having said that, do seek to ensure your health as well as that of those around you. Thank you for watching.